I'm Dr. Nirmal Surya. I'm the neurologist practicing at Bombay Hospital and Safi Hospital, and I'm the founder, trustee, and chairman of Epilepsy Foundation India. I'm holding certain positions in various organizations. I'm the president of Indian Federation Neurorehabilitation, treasurer of Indian Academy of Neurology, executive member of Indian Stroke Association, and I'm also holding two international positions, which is regional vice president for World Federation Neurorehabilitation, and also the member at large of Presidium of World Federation of Neurorehabilitation. I'm in practice since 1990 when I passed my diploma at National School of Neurology from Bombay Hospital. And since 2009, I'm running the NGO Epilepsy Foundation India, which is an ATG registered NGO working for the people with epilepsy. And we have been doing work with the National Health Mission, Government of Maharashtra, and interim Government of India for past 10 years, where we have been holding various camps across Maharashtra. And we have so far done 89 camps across Maharashtra in past 10 years. Today's subject which I'm going to talk about is not a known subject at all. In fact, when you talk about epilepsy, everybody feel that this is a disease of mentally retarded children or something like that. Patient is not normal. And many of them feel that it is not a disease which is treatable or it is genetic. And there are so many myths and taboos associated with epilepsy that whenever somebody get a convulsion, people either put the onion or the shoe, which is a myth because in those days, and people used to be hysterical and they were not unconscious. They were the one they will get up with the bad smell of shoes or onion. But now that we know that epilepsy is a disease of brain, there is a hyperactivity in the brain, in the neuron. It's like an electric activity, what we see during the rain in the clouds is similar sort of high voltage neuronal activity which discharges across the brain and causes person to become unconscious. Well, the further unknown is association of neurodisability with epilepsy. It's a relatively new subject, and now more and more people have started realizing that there is so much of neurodisability. Before that, I want to give you that there are nearly 65 million people across the globe suffering from epilepsy, and of which 85% people lives in developing countries. Currently, India, we estimate that there are 13 million people suffering from the epilepsy. That is 1% of population has epilepsy. Therefore, it is a very common neurological disorder. 1 in 100 suffer from epilepsy. And then there is a 30% association of neurodisability in epilepsy. And now what are the neurodisability? When we talk of disability, that means brain function or the neuromuscular function are compromised. And when we are talking of epilepsy, then there can be an epilepsy with physical disability. That means patient have weakness on one side of the body or some paralysis or some maldevelopment, or there can be a speech and swallowing disability. That means patient's speech is not developed because brain is not developed associated with epilepsy. Then there are learning disability. So nearly 30 to 35% of children have learning disability, and that has to be picked up early to be treated. Then there are cognitive disability. What we are meaning by cognitive is the patient have memory disturbance, patient has behavior abnormalities, patient have ADHD. These are much more common in children, between 7 and 20%, and the autistic features. So autism and epilepsy, 15-20% is a common association between the two. And then there are psychosocial disabilities. And what are the psychosocial? Because a patient with epilepsy, chronic disorder, long-acting medicine, family problems, there are a lot of social disturbances like depression, anxiety, etc. forms. And these are patients who are nervous, not able to perform, get a negative thoughts, not able to work out. And that's the reason they have a lot of problems. So we are looking at all form of disability with epilepsy. And therefore, every patient with epilepsy should be evaluated if they have an associated neurodisability. So if you have a speech disturbance, you need to look at whether there's speech is problem, there's swallowing is problem, learning skills, behaviors, memory, cognition, swallowing. And then, of course, there is a problem with their education because they get repeated fits. So children may not go to the school. There are huge dropout rate in the rural area. And even in the urban area, the children misses the classes, so their school performances goes down. The job is a problem. Then there is a marriage is a very big problem, particularly in female, and then parenting and child with them after the marriage, which is again a problem. Then there is a family burden because person is not able to perform everything, so that's another problem, which give rise to psychosomatic disturbances, and many of these patients have associated minor to major psychotic episodes along with epilepsy. Now, there can be some disturbances associated with long-term treatment. Some of the medicine can also give rise to behavioral disturbances, aggressive behavior, fetal disturbances in pregnancy. So we have to be very careful about selecting the drug, particularly young female who is of marriage age. Now, what are the problems? Why the epilepsy and neurodisability is problem? Because the poverty is one, which gives rise to the illiteracy, poverty, jabo, lack of awareness of epilepsy. It forms a vicious cycle. And because there is illiteracy, people do not take the treatment. People do not take the treatment. They have uncontrolled epilepsy. They have uncontrolled epilepsy means they cannot go either for the education or for the job, and that gives rise to a vicious cycle, and that needs to be really broken. So intervention at early stage. So any patient who have seizure at early age should be evaluated for associated neurodisability in the form of a learning disability, autistic feature, ADHD, the cognitive disturbance, behavioral disturbances, memory, physical weakness, etc. And that's how you could do the treatment and intervene them. And many of these people can be brought back to the normal. You will be surprised that in 89 camps so far, we have seen over 33,000 patients across Maharashtra. And of this, we have been evaluating in each camp for the people with neurodisability. So we have about selected physiotherapy for nearly 2,200 patients, occupational therapy for 3,300 patients, speech therapists for 3,100 patients, and psychological evaluation for 2,300 patients. So anything between 5 to 10% patient we have been evaluating in the camps where we suspect that there is associated neurodisability. And why I brought this to everybody's notice is that unless we look for it, we do not find. There are patients where the magnitude may be small, but larger the magnitude when patient is having paralysis or patient is having abnormal behavior, not able to talk. Obviously, everyone recognizes, but it is the smaller problems, less vulnerable problems, which needs to be treated, because if they can be controlled along with epilepsy, person can live a normal life. I hope you have understood the need of intervention, early intervention in neurodisability with epilepsy, and not only that, early treatment with the drugs or the surgery in a patient with epilepsy. As you know that 70% of patients with epilepsy are treated with one drug, and rest 10 to 15% can be treated with multiple drugs. And for those which are refractory epilepsy, we are now having better surgery and newer form of treatment available. So with that, I want to say thank you very much.